Hi, today we're going to be covering anatomy and physiology, so just make sure you have pen and paper nearby so you can take a lot of notes. This is one of the longer lessons in the course. After this lecture, you should be able to recognize, identify, and define common terms, structures, and functions of the human body as it relates to anatomy and physiology. You also want to recognize and identify medications that are commonly used with different organ systems. Finally, you want to comprehend the different types of pathogenic germs and the medications that are used to treat them. Starting with the basics, anatomy is the study of the internal and external structures of the human body. So this explains where parts of the human body are located and how they are positioned. This is how we actually name the body, where the organs are, not what they do. Physiology, on the other hand, is just that. This is the study of how the human body performs its vital functions. So this is going to focus on how each part of the human body works. So anatomy is simply saying, this is the bone, this is the organ, this is your skin, versus physiology is how is that bone moving? How is the muscle moving? How is the body working? Learning about anatomy and physiology is going to provide us answers as to how our body works, as well as how medications work in our body. Starting with the building blocks, the human body is the most complex organism on this planet. We're made up of billions of microscopic parts that are always working together in an organized manner just for the benefit of keeping us alive. The study of the human body is a never-ending quest, and despite years of studying the human body, we make new discoveries every single day. So we're going to talk about kind of the structure of the human body and the structure of how we're formed. So cells, these have been recognized as the simplest unit of living matter that can maintain life and reproduce themselves. All human bodies do start with a single fertilized cell. So this is the smallest that we ever are. We all start as one single cell. So I have an example here of a cell as well as the cell structure. Starting with the cell membrane, every cell in the human body is enclosed by a cell or plasma membrane. This cell membrane separates the materials outside of the cell from the contents inside of the cell. It also maintains the integrity of the cell and controls the passage of material inside and outside of the cell. So this is the gatekeeper who's keeping everybody in, keeping everybody out, controlling who goes in and controlling who goes out. And it's really important to note that all of our cells are fluid. They're not rigid. Because they're plasma membranes, they're made of lipids, meaning that they're nice and fluid so that we're not walking around with rock-hard skin. Then we have the nucleus and nucleolus. This is known as the control center of the cell. The nucleus determines how the cell is functioning, the basic structure of the cell, as well as contains the genetic material of the cell. So this is really the brain of all of your cells. Then we have the cytoplasm. This is the intracellular fluid where the other organelles or small organs within the cell operate. All of the functions that are carried out in the cytoplasm include expansion, growth, and replication. Then we have cell function. There are about 100 trillion cells in our bodies. All of our cells are differentiated by their function, so the structure of a bone cell is going to be drastically different from that of a nerve cell, because the function of these two cells are drastically different. The generalized functions of all cells are to exchange substances across the cell membrane, so again, who gets in and who goes out, produce new cells through cellular division, and then finally protein synthesis. So after cells, we have tissues. All of our cells come together to form tissues that have a similar structure and function together as a unit. These are more complex and are made up of many similar cells. We have 4 prominent types of tissues in our body. That includes connective, epithelial, muscle, and nervous, and we're going to dive into all 4 of these deeper. Starting with connective tissues, these hold structures together, forming a framework and support for organs in the body. They also store fats, transport substances, protect against disease, and help repair tissue damage. Then they're characterized by having fewer cells than all of the other tissues typically. And finally, they're able to reproduce rapidly, but not as fast as epithelial tissues. Then we have our epithelial tissues. These are widespread all over the human body. They form a covering all over body surfaces as well as line the body cavities, organs, and glands. They perform functions such as secretion, protection, absorption, excretion, filtration, diffusion, and sensory reception. All of our epithelial tissues are tightly packed because they line and cover different surfaces, so we don't want our epithelial cells to be loose because then anything could get on our skin and anything could get out of our skin. Epithelial tissues do differ based on where they're located, so epithelial tissues that line the stomach are designed for absorption, whereas those that line the glands are more designed for secretion. Then we have our muscle tissues. These have the ability to shorten and contract in order to provide movement of body parts and organs. They're characterized by containing numerous cells and they're well supplied with blood. Actin and myosin are the proteins that are in muscles that are responsible for muscle contraction. And there are three main types of muscle tissues. First, you have skeletal muscle tissue, which directly or indirectly connects to the bone. Then you have smooth muscle tissue, which is found around organs and blood vessels. Then you have cardiac muscle tissue, which is only found in and around the heart. Nervous tissue is found in the brain, spinal cord, and nerves. They stimulate muscle contraction, sense the environment, and help with memory and reasoning. They also communicate with each other through electric impulses. So after you step up from tissues, you have organs. So organs are made up of several different kinds of tissues that work together to perform a similar function. So now we've gone from a singular cell to cells coming together to form tissues, tissues coming together to form organs. And then as you can imagine, we have organ systems. So this is the makeup of many different organs working together to carry out a special function. So all of our cells came together to make tissues, tissues came together to make organs, and our organs are going to make organ systems. So our organ systems can also be divided up to many different parts. Each organ system has a dedicated purpose in the human body. All of the organ systems do work together to ensure the body is efficiently functioning. So we're going to discuss all of these organ systems, including the cardiovascular system, lymphatic system, endocrine system, respiratory system, digestive system, reproductive system, urinary system, nervous system, integumentary system, skeletal system, and muscular system. Don't worry if you didn't get all of those. We're going to go through each of them individually. Starting with the cardiovascular system, this system distributes blood, cells, water, and oxygen, among other things. Then we have our lymphatic system. This defends against infection and disease. Then we have our respiratory system. This provides oxygen to and removes carbon dioxide from our bloodstream via the lungs. Then our digestive system. This processes food and absorbs nutrients. Then our urinary system. This helps to excrete waste products from our blood with our kidney and our bladder. Our reproductive system produces sex cells and hormones. Our integumentary system protects against environmental hazards. Our skeletal system provides protection and support for other tissues. Our muscular system provides movement to the body. Our nervous system receives and directs immediate response to stimuli. And lastly, our endocrine system regulates metabolic activities and energy used by the body. So all human life processes include organization, metabolism, responsiveness, reproduction, movement, growth, differentiation, respiration, digestion, and excretion. No part of the human body works in isolation. All of it works together for the benefit of the individual as well as to keep us alive. So diseases such as cancer, infections, and of course death disrupt all of these processes. To maintain life, the human body relies on certain physical factors in addition to these life processes that are found in the environment, such as water, oxygen, heat, and food. Now that we've covered the basics of all of these systems, we're going to take a deep dive into these systems so that we can understand them better. So some common terms you're going to hear in this section include receptor, which is an organ, cell, or protein capable of responding to stimuli. An agonist, which is a substance that can elicit a response when bound to a receptor. And an antagonist, which is a substance that can stop the response of another chemical. We're going to first look at our integumentary system. This accounts for about 16% of the total human body weight and consists of the skin, hair follicles, sweat glands, nails, and sensory receptors. So the skin covers the human body surface, nourishes the epidermis, and provides strength. Our hair follicles, our hair protects the scalp from UV radiation so that we don't get sunburnt on our heads every day. And hair also guards the entrance to your nostril and external ear canals from any foreign objects. Our sweat glands produce perspiration for cooling, our nails protect our extremities, and our sensory receptors provide sensation to touch, pressure, temperature, and pain, and we're going to talk about that more with the nervous system. So now, looking at the most common skin conditions, the skin is the largest organ in the body. Conditions that irritate or inflame your skin can cause symptoms like redness, itching, and burning. Acne is by far the most common skin condition, which results in pimples, and it negatively affects appearance typically. Most medications that treat the skin will be a topical dosage form, so something like a triamcinolone cream, ointment, lotion, or solution for eczema or dermatitis, or like a benzoyl peroxide for acne, or salicylic acid as a wart remover. I've included here some common top 200 medications if you'd like to pause the video now to review them. Now we're going to move on to the skeletal system. The human skeletal system consists of bones, cartilage, ligaments, and tendons. It accounts for about 20% of the human body weight. So our bones provide support and protection for our soft organs of the body. All of our bones work together with our muscles to provide movement. They are attached using tendons like we talked about. There's cartilage. All of these things work together to provide us with all of the contractions and movements and flexibility that our bodies have. Bones also contain more calcium than any other organ in the body, so much so that when calcium blood levels become too low, calcium is released from the bones and vice versa. This is called a negative feedback loop. So once the body feels that there's not enough calcium in it, it's going to send to the bones a carrier that wants to extract all of that calcium and put it back into the blood for the body to use. On the cellular level, we have hematopoiesis, or the formation of blood cells. This occurs in the red marrow of the bones. There are also 3 types of cells that contribute to bone homeostasis. Homeostasis just means a stable internal environment. So basically, 3 types of cells that contribute to keeping our bones normal. That's osteoblast. This is the bone-forming cell. Osteoclast, which is the cell that breaks down old bone. And then osteocytes, which is a mature bone cell. So the balance between osteoblast and osteoclast is what maintains good bone tissue. Our bones do grow in length at the epiphyseal plate. The process does continue throughout childhood and adolescence, and it typically ceases close to our early 20s. Even though bones stop growing in length in the early adulthood, they do continue to increase in thickness or diameter throughout our life in response to stress from increased muscle activities or weight. So the osteoblast and osteoclast process is what keeps our bones from being excessively heavy and bulky, but it also keeps them from getting too frail. And the adult skeleton does consist of 206 named bones. So they have a lot of work to do with all of those bones. With that being said, osteoporosis is a disease that reduces the density of the bone. About 44 million Americans, mostly women, are afflicted with it. This is another imbalance of that osteoblast-osteoclast relationship where the bones are no longer as strong. Decreased bone's density increases the risk of fracture, so this could definitely be dangerous for elderly as they start to lose their bone mass. They are more prone to fractures. I've included an example of a top 200 medication that is associated with this class. If you'd like to study it now, you can go ahead and pause. Now we're going to cover the muscular system. There are more than 600 muscles in the human body, which account for about 40% of our human body weight. Muscle contractions are responsible for nearly all of the movements in the human body. Skeletal muscle is also responsible for subtle movements such as facial expression, eye movement, and breathing. So the four main functions of muscles are movement, posture, joint stability, and heat production. Nearly 85% of the heat that's produced in the body is a result of muscle contraction. So again, back to our types of muscle, we have skeletal muscles, smooth muscles, and cardiac muscles. Skeletal muscles have an abundant supply of blood vessels and nerves. They're attached to the bones and responsible for skeletal movement. They're also controlled by the central nervous system, which is why they are under voluntary control. Then we have smooth muscles, which can be found in the walls of internal organs such as blood vessels. So your smooth muscles can be seen in the GI tract, bladder, and uterus. They're involuntary muscles as they are under the control of the autonomic nervous system, so you don't have to think for these muscles to work. Finally, we have cardiac muscles, which are also found in the heart, and they're a hybrid of smooth muscle and skeletal muscles. These are also involuntarily controlled by the autonomic nervous system, so thankfully you do not have to stop and think to get your heart to beat. Then we have our major muscle groups. You are not expected to know each individual muscle, but I would know that the muscles are broken up as the muscles of the head and neck, the muscles of the trunk, the muscles of the upper extremities, and the muscles of the lower extremities. That's typically how the muscles are divided as far as proximity. Here I've included the common top 200 medications for this class. If you'd like to stop and study these, you could go ahead and pause the video now. Now we have the nervous system. The nervous system is the major controlling, regulatory, and communicating system in the human body. It's composed of organs such as the brain, spinal cord, nerves, and ganglia. Our neurons are nerve cells that conduct impulses, and they're made of three parts. These three parts are the cell body, the dendrite, and the axon. The cell body is the brain of the neuron, housing the nucleus. The dendrite are the extensions that carry an impulse to the cell body. And then axon is an extension that carries impulses away from the cell body. You can see examples of these all to the right. Once neurons are destroyed, they cannot be replaced as they do not go through mitosis, which is cell division and replication. This is why, unfortunately, we do have paralysis, is once our neurons are destroyed, they cannot be saved. They are not replicated. They do not heal themselves. We also have glial cells, which support and protect the neurons. Unlike neurons, they undergo mitosis and they do not conduct nerve impulses. So now the functions of the nervous system. There are three major functions of the nervous system, and that includes sensory, integration or integrative, and motor. Our sensory receptors detect changes called stimuli. Externally, they monitor temperature, light, and sound. Internally, they monitor levels of electrolytes, pressure, and pH. Then integrative or integration. All of those sensory inputs are transmitted to the brain and are brought together or integrated to create a decision and a memory. Finally, motor. Based on the sensory and integration that just happened, the nervous system sends impulses to the muscles and the glands to react. The nervous system is one unit, but it can be subdivided into two parts based on the structure and the function. The two subdivisions are the central nervous system, or the CNS, and the peripheral nervous system. The central nervous system consists of the brain and the spinal cord. Although these two are considered two separate organs, they are continuous. They're both encased in bone for protection. Our peripheral nervous system consists of the nerves and the ganglia. They transmit impulses to or afferent or sensory, and from efferent or motor, the CNS. So these are those sensory and motor functions that we were talking about in that last slide, and the integration is happening in the central nervous system. Remember that any condition pertaining to psychological perception, like pain management, antidepressants, and antipsychotics, as well as stimulants and sedatives, pertain to the nervous system. So even things involving sleep pertain to the nervous system. Because the body is controlled by sensory neurons and the brain's interpretation of those signals, medications that affect the nervous system are incredibly diverse. We're going to talk about some of those now, including stimulants, sedatives, antidepressants, opiates, and NSAIDs. Starting with stimulants, any substance that raises nervous activity in the body for a short amount of time is considered to be a stimulant. There are already a number of stimulants available over the counter, such as caffeine and nicotine, but there are also a variety of stimulants that are illegal, such as cocaine and methamphetamine. So this just goes to show you how wide of a class this is. The most popular prescription stimulant involves mixed amphetamine salts, which is a C2. This is also known as Adderall. Amphetamines are used to help people lose weight, as well as help people with ADHD concentrate. Next, we have sedatives. This is any substance that decreases neurological activity for a short amount of time. They could be used to help people sleep or to relieve anxiety. Prescription-only sedatives, which are C4, include hypnotics like zolpidem, benzodiazepines like alprazolam, and barbiturates such as phenobarbital. Then we have opiates. This is any substance that's isolated from the opium poppy or synthetically similar to that compound. Opiates depress the transmission of sensory pathways that signal pain. So how opiates work is they block the receptor that causes you to feel pain. So that sensory stimulation that's being sent to your central nervous system from your body will never get there because it can't land on that receptor, so you can't feel pain. Aside from opium itself, which is illegal, most opiates are only available by prescription. Oxycodone, hydrocodone, things like that are C2. You have codeine and Tylenol, that's C3. So some codeine-containing prescriptions are C3. They're not C2. When discussing antidepressants, it's super important for us to acknowledge that about 1 in 4 Americans are depressed, which explains the prevalence of antidepressants. Antidepressants are rarely abused, however, they do require prescriber intervention, so these medications are exclusively prescription medications. Most antidepressants fall into 4 subcategories. That's SSRI for fluoxetine, SNRI or something like venlafaxine, tricyclics like amitriptyline, and then MAOIs, which are very infrequently prescribed. Just for a refresher, SSRI is a selective serotonin reuptake inhibitor. SNRI is a serotonin norepinephrine reuptake inhibitor. Tricyclics just refers to tricyclic antidepressants. And MAOIs are monoamine oxidase inhibitors. Finally, we have NSAIDs or non-steroidal anti-inflammatory drugs. Non-narcotic analgesics reduce pain without depressing the nervous system and are not addictive, therefore they're not controlled by the DEA. NSAIDs are used most prevalently for pain relief, however they can also reduce inflammation and fever. An example of an NSAID includes ibuprofen. I've included some relevant top 200 medications here if you would like to pause now to study them. Again, we have another page of top 200 medications if you would like to pause and study them. Again, another page of top 200 medications. Feel free to pause again to study these. And then our final page of top 200 medications if you would also like to pause and study these. Now we're going to cover the cardiovascular system. This consists of the heart, arteries, veins, and capillaries. This system is very important because tissues need a continuous supply of oxygen and nutrients. The average adult heart pumps about 5 liters of blood every minute throughout their life. So obviously our heart gets put through quite a bit throughout our lifetime. The human heart consists of 4 chambers and is shaped roughly like a man's closed fist. The 4 chambers of the heart are the right atria, right ventricle, left atria, and left ventricle. The atria are thin-walled chambers that receive blood from the veins, and the ventricle are thick-walled chambers that are built to pump the blood out of the body. The heart also has valves that keep blood flowing in one direction. So following the blood pathway through the heart, deoxygenated blood flows to the right atria and then to the right ventricle. The right ventricle then pumps the blood to the lungs to receive oxygen. Oxygenated blood is now received by the left atria and then moves on to the left ventricle. The left ventricle simply pumps the blood into systemic circulation. It's both larger and stronger than the right ventricle. The right ventricle finally pumps blood only to the lungs. So here's an easier way for you to look through it. You see that blood comes in from the superior vena cava and inferior vena cava into the right atrium, where it then flows to the right ventricle. From the right ventricle, it flows to the pulmonary artery into the lungs. The lungs then flows from the lungs down to the left atrium into the left ventricle. The left ventricle then goes to the aorta, where it pumps to the rest of the body. So the major conducting system of the heart includes several components. The first part of the conducting system is the sinoatrial node, or SA node, also known as the pacemaker. The SA node acts alone to generate the impulse that causes the heart to contract. These impulses are sent to the AV node, which then distributes the impulse to the muscles of the heart, giving the heart its basic rhythm. So the SA node sends off the initial fire, which then reaches the AV node, and the AV node sends that message down and around that heart, causing the heart to pump. Our blood transports oxygen from the lungs to body tissues and carbon dioxide from body tissues to the lungs. The blood also carries nutrients, hormones, and disease-fighting substances to the tissues, as well as waste to the kidneys. Blood vessels are made up of 2 closed systems of tubes that begin and end at the heart. Based on their function, blood vessels are classified as either arteries, capillaries, or veins, and we're going to go more in depth for all 3 of those. Starting with our arteries, these blood vessels carry blood away from the heart. The pulmonary arteries carry blood away from the heart towards the lungs, and the systemic arteries are carrying our blood away from the heart to the rest of our body. Then we have our capillaries. These are the smallest and most numerous of the blood vessels. They form the connection between the vessels that carry blood away from our heart, our arteries, and the vessels that carry blood to the heart, our veins. This is also where the exchange of nutrients, gases, and metabolic waste occurs. Then finally, our veins. These are our blood vessels that carry the blood to the heart. The pulmonary vein carries our blood from the lungs back to our heart, and then the systemic veins carry our blood from our body back to our heart. So our myocardium is the muscle of our heart walls. These need a continuous supply of oxygen and nutrients to function efficiently. The heart has an extensive network of blood vessels that brings oxygen to the contracting cells and removes waste. This is what keeps our myocardium oxygenated. A myocardial infarction, or heart attack, is when the arteries that supply blood and oxygen to the heart muscle have been obstructed. So this is resulting in the heart not being able to get the oxygen it needs. And as you can see in this picture, we have the block and the ultimate damage in the muscle, so the damage in the myocardium, which affects the way the heart beats. The cardiac cycle refers to the alternating contraction and relaxation of the myocardium, which we just referred to. The contraction phase is called systole, and the relaxation phase is called diastole. Blood pressure is measured in millimeters over millimeter mercury and is reported as systolic over diastolic. Systolic pressure is due to ventricular contraction, and diastolic is due to ventricular relaxation. Blood pressure is measured using a sphygmomanometer, and blood pressure is an excellent representation of cardiovascular circulation. So a lot of times you're just going to hear this as a blood pressure cuff, and you'll use the stethoscope, a blood pressure cuff, to inflate. You'll wait until you hear the patient's pulse the first time, and then you'll sit there and you'll deflate until you stop hearing the patient's pulse. So that is the basic principle of taking blood pressure as well as assessing cardiovascular health. So the cardiac cycle refers to the alternating contraction and relaxation of our myocardium, or that muscle that we just discussed. The contraction phase is called systole, and the relaxation phase is called diastole. Blood pressure is measured in millimeter mercury, and it's reported as systolic over diastolic for that reason. So systolic pressure is due to the ventricular contraction, and diastolic is due to ventricular relaxation. We do measure blood pressure using a sphygmomanometer. We also call this a blood pressure cuff. So blood pressure is an excellent representation of cardiovascular circulation. The pulse is the rhythmic expansion of an artery that is caused by the ejection of blood from the ventricles. The sound associated with the heartbeat is a result of the vibration caused during the closure of the valves in the heart. A normal blood pressure is below 120 over 80 millimeter mercury, and a normal resting pulse for an adult ranges from 60 to 100 beats per minute. So remember that any medications having to do with circulation, blood pressure, and anticoagulation, among other things, act on the cardiovascular system. Heart disease is the leading cause of death in the United States. Due to the necessity to prevent and treat this epidemic, there are a huge amount of medications that are used to treat specific conditions of that disease. We're going to discuss blood pressure medications, cholesterol-lowering medications, and then, of course, give you examples of the top 200. So medications used to lower high blood pressure include ACE inhibitors, beta blockers, diuretics, and more. These medications commonly work on either the heart or the kidneys to reduce the pressure of the blood flowing through the body. In some cases, more than one medication is needed to efficiently lower blood pressure, so this is why we see combination medications that are made up of more than one type of blood pressure medication, such as lisinopril plus hydrochlorothiazide. Our medications that are used to lower cholesterol include fibric acid derivatives, HMG-CoA reductase inhibitors, and others. Remember, HMG-CoA reductase inhibitors are just statins. These medications work to lower LDL, or our bad cholesterol. They also work to lower triglycerides, and then they finally work to raise our HDL, or good cholesterol. Again, here are some examples of the top 200 medications that relate to the cardiovascular class. Feel free to pause it now to review these. Another page of the top 200 medications. Feel free to pause now. Another page of the top 200 medications. Feel free to pause now. Another page of top 200 medications. Feel free to pause once again. And the final page of top 200 medications as it relates to the cardiovascular system. So you can see that we have a ton of medications that work on our heart and our cardiovascular system as a whole. Feel free to pause to go ahead and look at these. Now we're going to move on to our lymphatic system. So the main function of the lymphatic system is to defend against invading microorganisms and diseases. Lymphatic organs contain lymphocytes that destroy invading organisms. The lymphatic system is also responsible for returning excess interstitial fluids from tissues to the blood. Finally, the lymphatic system also absorbs fat and fat-soluble vitamins such as A, D, E, and K from the digestive system and transports them into circulation. Our lymphatic system consists of fluid or lymph, vessels that transport lymph, and organs containing lymphoid tissues. It does not have a pump like the heart and the cardiovascular system. The movement of fluids in the lymphatic system occurs via the pressure gradient that's produced by skeletal muscle action, respiratory movement, and contraction of smooth muscle in the vessel walls. Lymphatic vessels, unlike blood vessels, only carry fluid away from the tissues. So some of our lymphatic organs include our tonsils, our spleen, our lymph nodes, and our thymus. Our tonsils are clusters of lymphatic tissue just under the mucous membranes that line the nose, mouth, and throat. The lymphocytes and macrophages in the tonsil provide protection against harmful substances and pathogens that may enter the body through the mouth or nose. Our spleen is the largest lymphatic organ, and it's shaped just like a lymph node. The spleen filters the blood just like the lymph nodes filter lymph. It has lymphocytes and macrophages to fight pathogens. The sinus of the spleen also acts like a reservoir for blood. So in the case of hemorrhage, so like a trauma or any other event when somebody would lose a lot of blood, the spleen contracts and blood is then supplied throughout the circulatory system. Our lymph nodes are small bean-shaped structures that are usually less than 2.5 centimeters in length. They are widely distributed throughout the body along the lymphatic pathways where they filter lymph before it is returned to the blood. The lymph nodes are made up of connective tissues and divided into compartments called lymph nodules. Inside the lymph nodules is where you find lymphocytes and macrophages that also fight foreign organisms and diseases. The thymus is responsible for processing and maturing our lymphocytes. So while in the thymus, lymphocytes do not respond to pathogens and foreign agents. However, after they enter the blood and other lymphatic organs, they provide defense against disease. So thymus is where all of your lymphocytes go to grow up, basically. Then we have our respiratory system. Under normal conditions, the average adult does take 12 to 15 breaths per minute. The respiratory system works with the circulatory system or cardiovascular system to provide oxygen and to remove the waste products of metabolism. It also helps to regulate our pH of our blood. Respiration is the sequence of events that results in the exchange of oxygen and carbon dioxide between the atmosphere and the body's cells. So we're going to talk about breathing, our upper and lower respiratory tract, asthma, allergies, and then some of the medications that relate to the respiratory system. So pulmonary ventilation is commonly referred to as breathing, and there are two phases, inspiration and expiration. Inspiration is the process of taking air into the lungs. This is known as an active process because there is muscular and diaphragm contraction. Expiration is the process of letting air out of the lungs. This involves the relaxation of the diaphragm and muscles, so it is a passive process. The conducting passages are divided into the upper and lower respiratory tract, and we're going to talk about those more. So the upper respiratory tract consists of the nose, the pharynx or the throat, and then the larynx or the voice box. Our lower respiratory tract is where we see a lot of the function of our respiratory system, though. Our trachea is our windpipe. It's the main airway to our lungs. It does have goblet cells that produce mucus, which traps airborne particles and microorganisms from getting to our lungs. The cilia also propels the mucus upwards, where it is either swallowed or expelled. Then we have our bronchial tree, which is similar to the trachea, but much smaller in diameter. They terminate in tiny little air sacs called alveoli. Exchange of gas between the air in the lungs and blood in the capillaries occurs across the walls of the alveolar ducts. Then finally we have our lungs. The normal human has 2 lungs, which occupies most of the space in our thoracic cavity. The lungs are soft and spongy to the touch, with the right lung being shorter but broader and has a greater volume than the left lung. The right lung does have 3 lobes and the left lung only has 2. I always remember this by our heart being on our left side. So the right side has the room for the 3 lobes, whereas the left side doesn't have room for 3 lobes because we have to have room for our heart. So asthma, about 10% of the United States are afflicted with asthma. Asthma is a condition where there is inflammation and spasm of the bronchi and the lungs. Asthma is easily treated through although compliance is an issue. So asthma ends up with wheezing, shortness of breath, difficulty with exercising. It's going to be a tightness in the airways. What compliance means is patients' ability to take their medications every day or as they're indicated to. So we have a big issue with patients taking their inhalers every day like they're supposed to, or only using their rescue inhalers as needed, which we're going to get into. So asthma treatments are split into quick relief or rescuers, like I said, and controllers. Our rescue inhalers include short-acting beta agonists like albuterol. We only want patients to use these when they have symptoms. Our controllers include inhaled corticosteroids like fluticasone, Leukotriene modifiers like Singulair and long-acting beta agonists such as salmeterol. All of our long-acting beta agonists do come co-formulated with corticosteroids like Advair, and these are the medications that patients should be taking absolutely every day, whether or not they're having symptoms. Then we have allergies. An allergen is any foreign substance that is handled, ingested, or inhaled that causes an overreaction of the body's immune system. Their seasonal allergies are allergic rhinitis, and they are by far the most common and are managed by using daily antihistamines. So these can be divided into first generation and second generation, with first generation antihistamines causing more drowsiness and needing to be taken more often. So an example of a first generation antihistamine is diphenhydramine or Benadryl, and a second generation antihistamine is loratadine or Claritin. All of these are now available over the counter, and we're also seeing nasal corticosteroids be used for allergies very often, so Flonase or fluticasone is also very good. It's important to differentiate between seasonal allergies and allergic reactions. Moderate allergic reactions can usually be remedied by taking diphenhydramine or Benadryl, but allergic emergencies such as anaphylaxis occur quickly, and they can have consequences including death. Epinephrine is commonly injected to treat anaphylaxis. So here we have top 200 medications that relate to the respiratory system. If you want to pause the video now to study these, please feel free to do so. And again, more top 200 medications. And the final page of top 200 medications for the respiratory system. Feel free to pause now to review them. We're now going to discuss our endocrine system. This consists of the glands and the hormones that they secrete. The endocrine system is responsible for important bodily processes like the handling of blood sugar and hunger. So our hormones are classified as either proteins or steroids. All hormones in the human body except for sex hormones and those from the adrenal cortex are proteins. Although hormones are carried throughout the body, they only affect certain cells. The specific cells that respond to a given hormone have receptor sites for that hormone. Hormones are very potent substances, which means a small amount of a hormone can produce a very significant effect. The endocrine system is made up of 8 major endocrine glands scattered throughout the body. However, hormone secretion is not the primary function of some of those glands. So our pituitary gland has an anterior lobe and a posterior lobe. The anterior lobe of the pituitary gland is responsible for secreting growth hormones that stimulate the growth of bones, muscles, and other organs. Common examples are thyroid-stimulating hormones, adrenocorticotropic hormone, gonadotrophic hormone, and prolactin hormone. The posterior lobe is responsible for the antidiuretic hormone that stimulates the reabsorption of water by the kidney tubules. This mechanism conserves water in the body. The pineal gland is responsible for the secretion of hormone melatonin. Melatonin affects our reproductive development as well as our daily physiological cycles. Then we have our thyroid gland, which consists of 2 lobes on either side of the trachea. Just below the larynx, it produces thyroxine as well as triiodothyroxine hormones. This is T4 and T3. These hormones contain iodine. The thyroid gland is also responsible for secreting calcitonin, which works with parathyroid hormones to regulate the amount of calcium in the blood. Now we're going to discuss hyperthyroidism and hypothyroidism. Hyperthyroidism is a condition where the thyroid gland produces too much thyroid. Only a couple medications are available to treat this disorder. Methimazole is the most common of these, but it's still frequently and not prescribed often. Occasionally, the thyroid is removed, in which case the patient has to take thyroid hormone replacement tablets for the rest of their life. That's called a thyroidectomy. In hypothyroidism, it's a condition where the thyroid gland produces too little thyroid hormone. There are only a few medications, such as levothyroxine and Armour-thyroid, that treat this disorder, but there are a plethora of different strengths for those medications, which I have them listed here. We then have our adrenal glands. The adrenal gland is located at the upper portion of our kidney. It's divided into the adrenal cortex as well as the adrenal medulla. The adrenal cortex secretes steroid hormones. We have mineralocorticoids. This is where you get aldosterone that conserves ions as well as water in your body. We also have glucocorticoids. This is where you get cortisol, which increases blood glucose levels. Then we have gonatocorticoid. This is where sex hormones or androgens for males and estrogens for females are secreted. And then finally, the adrenal medulla. This develops from neural tissue and secretes two hormones, epinephrine and norepinephrine. They are often secreted in response to stimuli from stressful situations. Then we have our gonads. These are the primary reproductive organs in males and females. We have the testes in males and ovaries in females, which are responsible for producing sperm and ova, which are very important in the reproduction process. They are also responsible for secreting sex hormones. The male sex hormones are called androgens, and the primary form is testosterone. Testosterone is responsible for the growth and development of male reproductive structures, skeletal and muscle growth, enlargement of the larynx, growth and distribution of body hair, as well as male sex drive. The main two female sex hormones are estrogen and progesterone. They are responsible for the development of breasts, the distribution of fat, maturation of reproductive organs, thickening of the uterine wall, changes that occur to the uterus during the female menstrual cycle, among other things. That leads to our pancreas. This is a long and soft organ that lies in the posterior of the abdominal wall. The exocrine or outer regions secrete digestive enzymes that are carried throughout the ducts, and the endocrine or inner region secretes glucagon by their alpha cells and insulin by its beta cells. Glucagon is secreted at low blood sugar concentrations, so this is almost like glucose to raise your blood sugar, and insulin is secreted at high blood sugar concentrations, so this lowers your blood sugar. This leads directly into diabetes. A little more than 8% of people in the United States do have diabetes, and there are two types of diabetes. You have type 1, which is insulin dependent, where the body does not make insulin. Then you have type 2, which is partially insulin dependent. The body doesn't use the insulin correctly or either doesn't make enough, and sometimes type 2 will go on to stop making insulin, period. So there are some essential products that diabetic customers need to test and manage their blood sugar. First is a lancing device and lancets. This is used to prick the skin and draw blood. Then we have a diabetic meter and test strips. This is typically the meters that are very inexpensive, while the test strips are among the largest cost to a diabetic patient. So the meters typically run anywhere from $10 to $25, but the test strips can be as much as $40 to $50 a month. The strips are loaded with a few drops of blood and put into the meter to be measured. Insulin syringes are used to administer insulin under the skin, and then pen needles are used in conjunction with insulin pens to inject insulin under the skin. So we're seeing less of syringes and insulin and more of the pen needles. Here I've included some top 200 medications as it relates to the endocrine system if you'd like to pause and study these now. Again, the top 200 medications as they relate to the endocrine system if you'd like to pause now. And the final page of top 200 medications if you would like to pause and study these now. Now we're going to review our digestive system. Food undergoes a 3-stage process in the body, and that's digestion, absorption, and elimination. Digestion is the breaking down of food into smaller particles, with absorption being the simple molecules from digestion passing through cell membranes and into the blood and lymph capillaries. Elimination is the process where food molecules that cannot be digested are eliminated from the body. Our digestive tract is also known as the gastrointestinal or GI tract. The GI tract processes food into molecules that can be absorbed and utilized by the cells in the body. It consists of a long continuous tube that extends from the mouth to the anus. It also includes the mouth, pharynx, esophagus, stomach, small intestines, and large intestines. So our GI tract is about 9 meters in length, and it starts from the mouth and ends at the anus, like I said. The GI tract is also made up of accessory glands such as the salivary glands, liver, gallbladder, and pancreas, and all of these are going to work together to secrete different enzymes and byproducts that are going to help you to digest your food and absorb your food. We're going to discuss our mouth and pharynx. So the first part of the digestive system is the mouth. It breaks down food with mastication or chewing and mixes it with saliva. It receives the saliva from an accessory gland called the salivary gland. We have these under our tongue. They're all in our mouth. Food is then forced into the pharynx by the tongue. The epiglottis drops downward to prevent food from entering the larynx and trachea in order for the food to go into the esophagus. When people choke to death from eating, it is a result of the epiglottis not dropping downward and food goes down into the trachea, which we discussed in the respiratory section, which prevents breathing. The connection between the pharynx and the stomach is the esophagus. Mucus is secreted here in the esophagus to ease the passage of food. The esophageal sphincter controls the movement of food in and out of the into and outside of the esophagus. So this is what's going to make sure that all of your food gets down into your stomach, but stays in your stomach. People that have GERD or gastroesophageal reflux disease or disorder, they have an issue with their top sphincter where the food starts to come back up and they start to feel that stomach acid in their esophagus because that sphincter isn't closing tight. The stomach receives the food from the esophagus. This is when enzymes and acids are secreted and chemical digestion of food begins. The relaxation of the pyloric sphincter allows chyme or processed food to pass into our small intestine. So our small intestine finishes the process of digestion and absorbs our nutrients before passing to the large intestine. This is also where the majority of medications are absorbed. The liver, gallbladder, and pancreas are also associated with the small intestine. So this is also the liver does and the gallbladder secrete byproducts into the small intestine for excretion. So it's just important to understand that all of these organs are working together to digest, absorb, and excrete our food. The large intestine does not produce digestive enzymes. The function of the large intestines is actually to absorb water, electrolytes, and then to eliminate our feces. The last inch, I'm sorry about that. Let's get back to where we were. There we go. The last inch of the digestive tract is the rectum and the anus. It's the main purpose of it is to excrete our waste. Unlike other sphincters in the digestive tract, the external anal sphincter is composed of skeletal muscle and is under voluntary control. So that is why, as weird as it is to say, we can clench if we have to go to the bathroom because we do have voluntary control of our external anal sphincter. Then we have our salivary glands and our liver. So the salivary glands secrete saliva into the oral cavity to help break down and lubricate food. Saliva is made up of water, mucus, and enzymes, so that as you're chewing, doing that mastication, you can go ahead and start breaking up your food and digesting it. The liver is the largest gland in the body. Blood from the digestive tract, which is loaded with nutrients, first has to pass through the liver. The liver filters and detoxifies the blood, secretes bile, which helps with digestion and excretion, and is also responsible for the metabolism of lipids, proteins, and carbohydrates. So our liver does a lot for keeping us healthy. Our gallbladder is a pear-shaped sac that is attached to the liver. The principal function of the gallbladder is to store bile. The main components of bile are water, bile salts, bile pigment, and cholesterol. Bile is also secreted by the liver, so bile salts act as an emulsifying agent in the digestion and absorption of fats. We're going to discuss acid reflux and GERD. We already did a little bit when we were talking about sphincters. So acid reflux is a condition where stomach content moves backwards into the esophagus, like I said. Gastroesophageal reflux disease, or GERD, is chronic acid reflux. So both are treated with antacids, histamine H2 receptor antagonists, or antihistamines, and proton pump inhibitors, or PPIs. Here you have some example of top 200 medications that relate to the digestive system. If you want to pause the video now so that you can review these, feel free to go ahead. We're now going to look at our urinary system. This maintains the volume and composition of body fluids within normal limits. It regulates the concentrations of various electrolytes in the body, as well as our fluids, and maintains a normal pH of our blood. Our urinary system also helps to produce our red blood cells by secreting erythropoietin, or EPO. And it finally maintains normal blood pressure by secreting the enzyme renin as part of the renin-aldosterone-angiotensin system. The components of our urinary system include the kidneys, ureter, urinary bladder, and urethra. The kidneys form the urine, which is then carried by the ureter to the urinary bladder. The bladder serves as a temporary reservoir until the urine is carried out of the body by the urethra. So breaking down our kidney, ureters, urinary bladder, and urethra. Kidneys are the primary organ of the urinary system. It filters the blood, removes our waste, and excretes waste in the urine. Our ureters are what carry the urine from the kidneys to our urinary bladder. Like I said, our urinary bladder is a temporary reservoir that's surrounded by elastic muscles. The contractions of these muscles is what expels our urine. And finally, our urethra is the final passageway for our urine. Female urethras are typically short at just 3 to 4 centimeters, where the male urethras are typically longer at 20 centimeters. This is why females are much more prone to urinary tract infections, because we do have shorter urethras, so it's easier for bacteria to get in. And here are some examples of medications that directly relate to our urinary tract or our urinary system. Go ahead and pause now if you'd like to review them. Then we have our reproductive system. The major role of the reproductive system is to ensure the survival of the species, making sure that we are reproducing. The reproductive system has 4 main functions: the production of sperm and eggs, the transportation of sperm and eggs, the development of offspring, as well as the production of hormones. First, we'll cover the male reproductive system. This consists of the testes, seminal vesicles, prostate, vas deferens, as well as the penis. The testes require a normal temperature of about 3 degrees Celsius lower than the normal body temperature, so the testes actually will raise and lower depending on how warm or cold they need to be in order to keep the sperm viable. So the lower temperature is necessary for viable sperm, making sure the sperm survive. The duct system, the sperm passes through a series of ducts to reach the outside of the body. After it leaves the testes, it passes through the epididymis, vas deferens, ejaculatory duct, and urethra. The passing of sperm through these ducts is necessary for the maturation of the sperm, as secretions are added to help sperm motility. Finally, we have the urethra. This serves as the passageway for sperm and fluids from the reproductive system, as well as urine from the urinary system. While the reproductive fluids are passing through the urethra, the bladder sphincter actually contracts very tightly to keep urine from entering the urethra. So a male actually cannot physically ejaculate and urinate at the same time. The accessory glands in the male reproductive system include the seminal vesicles, the prostate, the bulbourethral glands, and the seminal fluids. They help in enhancing the motility of sperm, neutralizing the acidity of the vagina, and providing additional secretions or semen. The volume of semen in a single ejaculation may vary from 1.5 to 6 milliliters, and there are usually between 50 to 150 million sperm per milliliter of semen. It only takes 1 sperm out of all of these to fertilize an egg. The male sexual response includes erection as well as orgasm, or the ejaculation of semen. The female reproductive system, on the other hand, sustains female sex cells or eggs and provides an environment for the developing fetus. The female reproductive system includes the uterus, ovaries, fallopian tube, vagina, and accessory structures. So there are 2 ovaries, and they are the primary female reproductive organ. The ovaries are located in a shallow depression on each side of the uterus. The female sex cells develop in their ovaries by a form of meiosis called oogenesis. Fallopian tubes are where there are 2 fallopian tubes, which are where uterine tubes, where the oocyte or female sex cell moves from the ovaries to the uterus. The journey from the fallopian tube does take about 7 days, and an oocyte is only fertile for 24 to 48 hours, so fertilization often So there are two ovaries, and they are the primary female reproductive organs. The ovaries are located in a shallow depression on each side of the uterus. The female sex cells develop in the ovaries by a form of meiosis called oogenesis or oogenesis. Fallopian tubes. There are two fallopian tubes, which are uterine tubes where the oocyte, female sex cell, on the other hand, is. So there are two ovaries, and they are the primary female reproductive organs. The ovaries are located in a shallow depression on each side of the uterus, and the female sex cells develop in the ovaries by a form of meiosis called oogenesis. The fallopian tubes, we have two of them. They are uterine tubes where the oocyte or female sex cells move from the ovaries to the uterus. The journey through the fallopian tube takes 7 days, and because an oocyte is only fertile for 24 to 48 hours, fertilization typically occurs in the fallopian tube. Our uterus is a muscular organ that receives fertilized oocytes and provides an environment for the development of the fetus. The vagina serves as a passageway for menstrual flow, receives the erect penis during intercourse, and it is also the birth canal during childbirth. Finally, we have your external genitalia. This includes the labia majora, mons pubis, labia minora, clitoris, and glands within the vestibules. They are considered accessory structures to the female reproductive system. The female sexual response includes arousal and orgasm, but there is no ejaculation. Women may become pregnant without orgasm, which is not the same for men. Men do have to orgasm in order to cause pregnancy. Follicle-stimulating hormone, luteinizing hormone, estrogen, and progesterone have major roles in regulating the function of the female reproductive system. Menopause occurs when a woman's reproductive completely stops later in life. This is typically around 55, and it's when the body has run out of sex cells completely. Then we have our mammary glands. The mammary glands are modified sweat glands that produce milk. They're located under the breast and are present in both males and females. However, they're usually only functional in females. The mammary gland function is regulated by hormones. At puberty, increasing levels of estrogen stimulates the development of glandular tissue in our female breasts. So most often, medications prescribed that concern the reproductive system are that of contraceptives. Contraceptives are devices, techniques, and medications that prevent pregnancy. They may include oral contraceptives to be taken by mouth or vaginal contraceptives to be inserted into the vagina. Other contraceptives include injections, intrauterine devices or IUDs, and implants. All of these options require a physician to administer the medication. Here we've included some common top 200 medications that have to do with the reproductive system. If you want to pause now, most of these are oral contraceptives. You could go ahead and study them. We are almost done. We're going to end by talking about germs. Germs are any pathogenic microorganism that invades the human body. Pathogenic simply means disease-causing. They're typically divided into 3 common categories, so bacteria, fungi, and viruses. Starting with our pathogenic bacteria, these are single-celled organisms that produce toxins. Common symptoms include fever, inflammation, and pain. Examples include tuberculosis, some kinds of pneumonia, syphilis, tetanus, and strep throat. And antibiotics are used to treat bacterial infections. So there are thousands of different antibiotics, and the list grows almost daily. Some of the most common classes of antibiotics are beta-lactams, which include cephalosporins and penicillins, macrolides, fluoroquinolones, and tetracyclines. I've included here some of the common top 200 antibiotics if you'd like to pause now to study. We also have pathogenic fungi. There are a variety of different treatment options for fungi depending on the nature of the infection as well as the severity of the infection. Some of the most common fungal infections are those of athlete's foot and yeast infections, and they have OTC treatments available or over-the-counter treatments. More complex and systemic fungal infections are treated with prescription antifungals. Here I have the only top 200 medication that I know of that's commonly associated with fungi. If you'd like to pause it now to study it, you can. Then we have pathogenic viruses. So many viral infections are left to the body's immune system to take care of. In some cases, we do have antivirals that are used to treat specific viral infections such as the flu or herpes simplex virus, or HSV. And here I have the common top 200 antivirals if you would like to pause it and study it now. So in summary, as a pharmacy technician, it is important to understand the anatomy and physiology of the human body in order to understand the related disease states as well as the medications. Most of the medications in the top 200 list, as you saw today, can be divided by the organ system they primarily are involved with. Germs include bacteria, viruses, and fungi, and they are each treated with a different agent. I know that this class was absolutely a lot. It covers a lot of information. If you have any questions, feel free to reach out or use all of the study materials we have provided you in the chapter.